Firstly, please allow me to express my excitement and gratitude to the conference committee for supporting my experiment on Wenxin-formula and giving me the valuable opportunity to communicate with you. I'm currently a postdoctoral fellow at Dongzhimen Hospital, Beijing University of Chinese Medicine, working on coronary arterial disease. Allow me to briefly introduce the uh, Chinese medicine. The development of traditional Chinese medicine originated from the ancient Chinese philosophical thought and is one of the most important representatives of ancient Chinese wisdom. Chinese medicine believes that human beings are a product of nature and they are a unit. Compared with nature, human beings are insignificant, so human living habits should also follow the laws of nature in order to maintain a healthy physical state. At the same time, humans can use nature's products to cure the disease. Um, to recognize one's own insignificance and limitations is a kind of advanced wisdom, because such self-reflection and denial are very precious. It's not difficult to realize that this way of thinking is diametrically opposed to the modern medicine, and being able to be compatible with both ideas is very difficult and requires an inclusive mindset. Very often, this is the deep-seated reason why Chinese medicine and the modern doctors often reject each other. In Chinese medicine, the things of always could be microscopically divided into yin and yang. To set a few examples, it may be better to comprehend. The woman is yin, man are yang. The moon is yin, the sun are yang. Water is yin, the fire is yang. Yin has the function of nourishing, and yang has the function of warming and promoting the operation of things. With the increase of the age, our body's yang energy continues to decline, so there will be inevitable phlegm, congestion, and other pathological products. Zhang Zhongjing, the sage of ancient Chinese medicine, believed that deficiency of heart yang and the formation of pathological products were the main causes of coronary arterial disease, and created 瓜蒌蟹白半夏 formula. Many people know about Chinese medicine because of Professor Tu Yu, who was inspired by the ancient Chinese medical book. It said, "Atherosclerosis I knew can cure the malaria," so she extracted atherosclerosis and won the Nobel Prize for Medicine in 2015. My mentor, Professor Cao Hongxin, who was president of Professor Tu Yu's organization. Now, he is the Chinese medicine healthcare expert for Tu Yu and many other senior Chinese officials. Professor Cao Hongxin inherited and developed the ideas of Zhang Zhongjing and created the Wenxin-formula, which has been used in the treatment of coronary arterial disease for 30 years. The term Wenxin-formula means a formula that can warm the heart. I spent 3 years of my postgraduate studies in the hospital ward and was exposed to the modern medicine. Luckily, I met my Dr. Tutor Cao Hongxin, and was reintroduced to the value of Chinese medicine. I found that regular use of Wenxin-formula not only improved the symptom of angina, but also reduced the narrowing of coronary arteries in many patients with CAD. And this is unbelievable in modern medicine and also surprised me. But many Chinese traditional doctors have their own limitations. They don't understand evidence-based medicine and also don't understand basic experiments. These limitations have led to Chinese medicine not being recognized by a large group of people. The ApoE deficient mouse is a commonly used model for atherosclerosis, in which blood lipids are several times higher than the normal. Typically, we believe that this model is less likely to produce efficacy than humans. So it would also be persuasive if the Wenxin-formula achieved the significant efficacy in this animal model. For these reasons, I designed my experiment. In order to evaluate more realistically and comprehensively, I photographed and stained almost all the vessels during the sampling. The experiment showed that Wenxin-formula drastically reduced the formation of pathological plaques and also reduced the infiltration of inflammatory cells around the pathology. These are model group. These are Wenxin-formula group. And these are lipid lowering drugs group. What is more amazing that Wenxin-formula doesn't has the significant lipid lowering effect, but it has the effect to reduce plaque. So this mechanism should be deeply studied. Chinese herbal formulas contain hundreds or even thousands of compounds, so the process of action differs greatly from that of monomer. However, the current experiments on Chinese herbal formulas have borrowed so much from the method of monomer drugs, which is unreasonable in my view. The omics and the network pharmacology are more coincident with the mechanism characteristic of Chinese herbal formulas, but the accuracy of these techniques is still in the process of improvement. Through sequencing, we identified 30 atherosclerosis-associated microRNAs, and Wenxin-formula effectively regulates 18 of them. In addition, we found some interesting phenomena in the network pharmacological study on Wenxin-formula. Multiple compounds focus on several key diseases. Key targets and pathways, and at the same time, multiple targets are linked to the key compounds. The whole network is distributed in a collection-like manner, rather than a haphazard one. We are looking for better experimental protocols, but the mechanistic part of my experiment is relatively normal, so I won't go into details here. I'm still conducting more experiments on Wenxin-formula and hope to present more valuable and real experimental results in the future. Many people think that Chinese medicine is a pseudoscience, whereas I would say that at present we lack an ideal experimental method to study Chinese medicine. I always pondered why Professor Tuyo didn't study atherosclerosis anew, but chose atherosclerosis instead. The mechanism may be more clearly elucidated by extracting monomer in herbs, which is in line with the experimental concept of modern medicine, and in this way, it is more likely to recognized by the profession. But it has a little difference from the application of Chinese medicine in daily life. The combined application of multiple herbs is one of the key features of Chinese medicine, and perhaps boiling atherosclerosis anew in water and drinking it is a simpler and cheaper method, as recorded in ancient book. Maybe it is more likely to benefit a wider range of people in this way. Chairman Mao, the founding father of China, once said that the traditional Chinese medicine is a great treasure that should be deeply explored. I would like to say that the time is the best funnel, which could filter out the falsehoods and remains the value after thousands of years. Many patients in China are choosing a combination of Chinese and modern medicine, which has greatly increased the clinical benefit. Just as China is a fusion of traditional culture and modern science, Chinese society is also compatible with a market and planned economy, which has greatly contributed to the Chinese rapid development over the past 30 years. Chinese medicine originated from the wisdom of ancient China, but it should benefit human beings all over the world, not only for China. The Chinese medicine belongs to the world. We believe that the combination of Chinese and Western medicine will burst with great energy. At last, I would like to reiterate my gratitude to the committee for giving me the opportunity to make a presentation, and my best wishes for a successful session. Thank you.